Hello, this video will be going through what to do before, during, and after both a doctor's office visit and a pharmacy visit. This is the agenda that goes over what we just talked about. That would be included in the video. So what to do at a doctor's visit. So this slide will be going over what information I have ready during a new patient appointment. Most of this information applies to an appointment in a physician's office that you've already seen and already built that relationship. So before calling ahead, make sure that you have your insurance card ready, that you call within business hours, so look ahead to see what those are. Make sure you know what the reason for the visit is, whether it's a wellness visit or a visit for a specific health concern that you have. That way when you call and ask for an appointment, you can tell them and they can be more informed. That insurance card will be handy when they ask for the name of your insurance and other information that's on that card. If you have a specific provider that you wish to see, especially if it's a primary care physician that you want to establish, make sure you have that name to double check that they are in fact accepting new patients. And of course, you want to give them the dates and times that you're available. That way you can actually make your appointment. So this slide goes through what things you could ask while still on that phone call making that appointment. Specifically, if you have any questions or requests for example, a translator or other medical needs that you have, you can ask if you need to bring anything. Sometimes physicians would ask you to bring the medications you're currently taking and all sorts of supplements as well, or a vaccination card for your records, or other things in that sense. And so you want to make sure that you are prepared and bring that ahead of time, or bring that for your appointment. And then you can also ask if there are forms you need to complete. Usually that can be done online in a check-in process, or it could be a printout and you can fill it out and take it into your next appointment. And so they'll usually tell you that on the phone prior to your appointment. You can also ask what to do if you need to cancel. Most physicians will have a cancellation fee if you cancel within a certain amount of time. That is what their policy might be. And then, of course, if you have questions that you would want answered at your office visit, you can do this at a separate time before your visit. Write down those questions, or make sure that you just pay close attention to what you might want to ask. That way you can have your questions answered when you're actually at your visit. One of the things that you want to make sure that you definitely bring to your doctor's appointment is your insurance card. This is very important, along with a photo ID for your physician's office to be able to bill you for any services you get there. You want to make sure you either have completed online or bring in completed forms, that ask about your medical history or the concerns that you have. That way your visit can go a bit more smoothly. If you have a copayment that you know you need to pay, make sure you bring a method for payment. And if you have any questions written down, make sure you go ahead and ask them when you're there. So what things you should be doing while speaking with your doctor are asking questions about your health. You may be asked to explain your medical history as well as your family's medical history. You can also ask if it's about a specific health concern or something comes up. You can ask for guidance or written materials to take home with you. And if you're recommended a medication, you can ask for it to be sent to a specific pharmacy that is in network. And if you know you need a generic form for your insurance to cover it completely or to have a lower copay, you can go ahead and ask for it to be in generic form, and your physician can go ahead and do that for you. So continuing on, you can ask your physician if you know you need to go get care from a specialist and you need a referral. You can make sure to ask for a referral. If you need to come back after some tests, you can ask and just double check if you need a follow-up appointment to be made. You can also ask if there is a 24/7 nurse line or physician phone number for you to call. And, just make sure before you leave that you understand the status of your health, what to do next after this visit. So if that includes testing or medication to take or certain treatment to go get, that you know that is what you need to do. And so after speaking with your physician and getting your appointment done, you'll be taken back to the front office. And that's where you can go to the front desk or the billing desk if there's one separate from the front desk. And you can ask to complete your payment or, provide a copayment if that applies to you at that time. You can also ask the front desk to schedule a following appointment that would be coming up, or to ask for any sort of documents that your physician did not provide you with. And so that could be a referral, a lab order, treatment information, or any sort of guidance as well. Next, we'll be going through what it takes to go to a pharmacy. And so once you have arrived at the pharmacy, you would want to check to see which station or cubicle you go into. And so there's either the pickup side or a drop-off side. And the real main difference between the two is whether or not your prescription was sent electronically or was given to you printed out by hand. And so you go to the pickup if it was electronically sent, and drop-off if it was by hand. And so you go to the pickup area, you'll go ahead and tell them your date of birth and name, and they'll check to see that your prescription is in their system. If it is, you'll be told to wait and have them fill the prescription, which is similar to what would happen in the drop-off area. Once your prescription is ready, you can go ahead and pay for it. So have that, insurance card and a payment method ready if you have, say, a copayment to pay. If you don't have your insurance card, or you don't have insurance that covers pharmacy or prescription, medication, you can always bring a discount card with you. And then you'll go ahead and pay, and you may just be sent to speak with the pharmacist to talk about your medication and how to take it. And then you can always sign up for refill reminders. That way you know when to come back if you need a refill on your medication. So overall, this presentation went through what to do and how to create an appointment with a new physician if you're a new patient, as well as what to do if you're not new, how to prepare for your office visit. We also went through some of the things you should keep in mind while speaking with the provider, and then how to pay for that physician's appointment and services. And then we also went through how to go to a pharmacy and get the medications that you've been prescribed. And so hopefully this presentation makes it a little bit more easy and potentially less stressful in order for you to engage and receive healthcare.